Hey guys, so in this video I wanted to respond to a comment that was left on one of my videos. So this comment was left on the video titled "Working as a Remote Patient Monitor," and this person doesn't have like their name as a username. It's just user dash a bunch of random letters and numbers, but I still want to respond to this anyway. And if you see me looking this way, I do have my laptop open and a couple of notes written about like my opinions on this subject. So this person asked the following question. She said, "What is the value of RPM?" RPM being remote patient monitoring. So I will tell you, I have seen firsthand the value or benefit of having a remote patient monitoring system in place. It has been very helpful for a lot of our patients in the rural health clinic that I currently work for. I will say that there are a lot of people that could benefit from this, whether you are in a rural health system or like a rural area, or whether you are in an urban area, honestly. I will say that being able to monitor a person's health from their home without having to make them come into the clinic is definitely helpful as well. It is technically like a telehealth type option for patients, and a lot of our patients really like the fact that it can cut down on the amount of times that they have to come into the clinic. A lot of people in the area that I currently live in, which is in the Upper Peninsula of Michigan, they don't necessarily have the funds to buy a vehicle, or they don't own a vehicle, or they cannot pay someone to get back and forth to appointments, or it's hard for them to secure a ride to and from appointments. Or they're so spread out from the clinic that they're not necessarily able to come unless it's on a certain day, or they have to try to get a ride from someone, or certain insurance programs will help pay for these rides, but you have to like set it up beforehand, and that makes it difficult if somebody needs like a last minute appointment and things like that. Being able to monitor somebody's health from home also helps like cut down on their chance of getting sick from being around other sick people. Whether like if someone is immunosuppressed, for example, or undergoing cancer treatment or whatever the case may be. Maybe it's just an older person who tends to get sick really easily for whatever reason. It's helpful to be able to have them monitor their blood pressure and their blood sugar and their weight and things like that from home, and maybe do a phone visit with a provider instead of having them have to come all the way into the clinic and be around people who may be coughing, sick, etc., etc. So with remote patient monitoring, it does allow the provider to manage and monitor certain chronic conditions, whether that's diabetes, hypertension, somebody being overweight. There's a whole range of problems that can be helped by having someone monitor their vitals from home. It also allows the patient to become responsible in their own health care. So by teaching people how to take their own vitals at home, or by, trying to get patients into a routine of checking up on their health, checking their vitals, checking their blood sugar, things like that, it's making them responsible for their own health care. And I think a lot of people, when they know that they have to be responsible for their own health care, they tend to take things a little bit more seriously. Obviously, not in every case, but I've noticed there are some patients that I have cared for personally in the clinic that I currently work at, where, once they got enrolled in our either chronic care management system or our remote patient monitoring system, or both, they have tended to become more involved, learn more. They're more eager to try things that might help their health that they may not have been willing to try beforehand. And, it's becoming very popular. I will say that. We currently have a program going on at the clinic I work at where Medicare Part B, I think it only covers Medicare Part B patients, or patients with Medicare Part B, I should say. They can get a free scale, a free blood pressure cuff, and a free glucose monitor to check their blood sugar if they need those. Like if they don't have diabetes or whatever, then they obviously wouldn't get the blood sugar monitor. But if they are in need of those, they will get those for free. And then it hooks them up with like a care manager and someone who they can ask questions to, someone who is there to answer questions, help them with other things that they might have going on. But I think that it helps them better understand what's going on with their health. They have somebody who can help them be more involved in their own personal health care. Like I said, it also does help with travel costs, with getting back and forth to a clinic or a hospital, depending on what type of appointments the person is needing. I would definitely, recommend that people try it at least. I did find it was on medicaleconomics.com. So remote patient monitoring, this is just kind of like the amount of money that it saves people on average, based on their healthcare needs. So it says, obviously this is just a very random number. Remote patient monitoring offers patients a clear return on investment over time with an estimated range of $1,390 to upwards of $7,000 per individual, depending on their healthcare needs. And so that could be between just trying to get to and from appointments or I don't know, whatever the case may be. So I would say that, a lot of people could definitely benefit from it. I do think that it also teaches people how to be more responsible for their health care, because a lot of people, before they start these types of programs, they don't really understand the things that they need to do in order to continue to live a healthier life. They don't understand how certain things can affect their health, and just how the smallest of changes can affect their health in very positive or very negative ways. So that is kind of like an overview. I can definitely go more in depth if you'd be interested in more in-depth information, but I would definitely recommend remote patient monitoring to any person that has a chronic health condition, especially elderly people who may need a little bit more assistance with things. And I don't say that in a negative way. I mean it in the most positive of ways. But I know there's a lot of elderly people that have a lot of questions, and busy clinics and doctors' offices are not always able to spend a whole lot of time on the phone trying to answer these questions. And that's when chronic care management and remote patient monitoring and things like that need to get involved to kind of help them figure out a way to self-manage their health. So I hope that answered your question. If you guys have any other questions like this or any topics you would like me to discuss on my channel in the future, I would be more than happy to make a video talking about your topic or your question. And with that being said, I hope you guys are having a wonderful day, and I will see you guys again next time.